Hello friends, welcome all of you on my YouTube channel Anand Nursing File here. Today in this video we learn about the nursing care plan on kidney stone, renal calculi या यूरोलिथियासिस। आज हम वीडियो में नर्सिंग केयर प्लान रीनल कैलकुलाई का यहाँ लर्न करेंगे, जिसको हम रीनल कैलकुलाई को हम किडनी स्टोन या यूरोलिथियासिस के नाम से जानते हैं। मीन्स सभी का एक नर्सिंग केयर प्लान यहाँ बनेगा। रेनल कैलकुलाई सेम एज किडनी स्टोन और सेम एज यूरोलिथियासिस। इन दिस nursing care plan we use the different nursing process step, nursing assessment, diagnosis, goal intervention, rational and evaluation। तो ये देखते हैं नर्सिंग केयर प्लान ऑन रीनल कैलकुलाई। Here, before learning the nursing care plan, we first introduce here the what is the renal calculi. Here, renal calculi means here same as urolithiasis is the process of forming a stone in the kidney. Means renal calculi या urolithiasis means किडनी में स्टोन का बनना या ब्लैडर में स्टोन का बनना या यूरेथ्रा में या यूरिनरी ट्रैक्ट में स्टोन का फॉर्मेशन यूरोलिथियासिस रीनल कैलकुलाई या किडनी स्टोन के नाम से जाना जाता है। किडनी स्टोन जिसको हम कैलकुलाई के नाम से जानते हैं आर फॉर्म मिनरल डिपोजिट मोस्ट कॉमनली कैल्शियम ऑक्सलेट एंड कैल्शियम फॉस्फेट। जो स्टोन है वो मिनरल डिपोजिट के कारण बनते हैं, जिसमें कैल्शियम ऑक्सलेट और कैल्शियम फॉस्फेट मुख्य मिनरल हैं। और कभी कभी ये यूरिक एसिड स्ट्रोबाइटन सिस्टीन स्टोन फॉर्मेशन में हेल्प करते हैं। नेक्स्ट, renal calculi can form anywhere in the urinary tract. They are most commonly found in the renal pelvis and calyx। मीन्स ये renal calculi यूरिनरी ट्रैक्ट में कहीं भी हो सकता है और सामान्यतया रीनल पेल्विस या कैलिक्स में पाया जाता है। नेक्स्ट, renal calculi can remain asymptomatic until pass into the ureter and urine flow is obstructed when the potential for renal डैमेज इज एक्यूट। मीन्स रीनल कैलकुलाई एसिम्टोमेटिक होता है जब तक कि यूरेटर या यूरिन फ्लो को ऑब्स्ट्रक्ट नहीं करे। और ये पोटेंशियल रीनल एक्यूट पोटेंशियल फॉर रीनल डैमेज। नेक्स्ट, देर आर 4 types of stone, mainly calcium stone, uric acid stone, strobite stone and cystine stone प्रेजेंट होते हैं। नेक्स्ट, दिस इज the kidney stone here, different stone you see in diagram here. These are the various stone in kidney, means calculus या कैलाई, जिसको हम रीनल कैलकुलाई के नाम से भी जानते हैं। नेक्स्ट देखते हैं डिफाइनिंग कैरेक्टरिस्टिक्स फॉर मेकिंग नर्सिंग केयर प्लान here. Sign and symptoms. Defining characteristics means sign and symptom here: severe sharp pain in the side and back below the ribs. Next, pain that related to lower abdomen and groin. Next, pain that come in the waves and fluctuate in intensity. Next, pain on burning sensation while urinating, pink, red, brown urine, cloudy or foul smelling urine. Next, a persistent need to urinate. Urinating more often than usual, urinating in the small amount, nausea and vomiting, and fever and chill if an infection is present. These are the signs and symptoms. Next, nursing care plan for this. Here, nursing care plan for renal calculi or urolithiasis mainly. Here, first acute pain, second impaired urinary elimination, next risk for deficient fluid volume and deficient knowledge. These are the नर्सिंग केयर प्लान इन दिस वीडियो ईयर। तो देखते हैं फर्स्ट नर्सिंग केयर प्लान अक्यूट पेन। फर्स्ट नर्सिंग केयर प्लान डायग्नोसिस ईयर अक्यूट पेन। Here in this care plan we use different nursing process step: nursing assessment, diagnosis, goal intervention and rational and evaluation. Right in the last after completion of the evaluation, after completion of the interventions. तो हमने यहाँ पे एवेल्यूशन लास्ट में दिया हुआ है. तो फर्स्ट देखते हैं नर्सिंग असेसमेंट में सब्जेक्टिव डाटा एंड ऑब्जेक्टिव डाटा. सब्जेक्टिव डाटा पेशेंट says that he is having pain, and objective data vital sign guarding distraction behavior, restlessness, mourning, self focus in facial mask of pain, muscle tensions. These are the objective data for this diagnosis. On the basis of these data we plan here the nursing diagnosis. Means हम सब्जेक्टिव और ऑब्जेक्टिव डाटा के बेस पर यहाँ पर नर्सिंग डायग्नोसिस को बनाएंगे. हमारा यहाँ नर्सिंग डायग्नोसिस होगा यार acute pain related to increased frequency, force of urethral contraction. Means due to increased frequency and force of urethral contraction, here patient feeling acute pain. The goal होगा हमारा to relieve pain and nursing intervention and रेशनल. देखते हैं acute pain को ठीक करने के लिए कौन कौन से इंटरवेंशन हम यहाँ यूज़ करने वाले हैं. फर्स्ट देखते हैं यहाँ पर डिटरमाइन and note location, duration, intensity 0 to 10 scale and radiation of the pain here rational to aid to evaluate the site of obstruction and progress of calculi movement. Flank pain suggests that the stone are in the kidney area, upper ureter. Flank pain related to back, abdomen, groin and genitalia. तो सबसे पहले हम पेन का इंटरवेंशन असेस करेंगे लोकेशन साइट पेन स्केल पर. नेक्स्ट सेकंड इंटरवेंशन हियर justify and clarify cause of pain and the need of the notifying caregiver of changes in pain occurrence and characteristics. Here alert caregiver to a possibility of passing of a stone and developing complications. Sudden cessation of the pain usually indicate a stone. Next intervention implement comfort measures, back rub, restful environment. Here rational for this promote relaxation, reduce muscle tension and enhancing coping. Next number 4 the intervention encourage use of focused breathing, guided imaginary diversional activities. Here rational for this redirect attention and help in muscle relaxation. Next number 5th intervention assist with the frequent ambulation as indicated and increase fluid intake of at least 3 to 4 liter a day within the cardiac tolerance. Here rational for this a renal colic can be worse in the supine position. Vigorous hydration promote passing of stool, prevent urinary stasis. Next number 6 there document reports of increased and persistent abdominal pain. Here rational for this complete obstruction of the ureter can cause perforation and extravasation of the urine into the perineal space. This represents an acute surgical therapy. Next intervention here apply warm compress to back here, relieve muscle tension and may reduce reflex spasm. Next 8 intervention here check and sustain patency of the catheter when used here, prevent urinary stasis or retention, reduce the risk of renal infection. After providing these interventions, we write the evaluation steps of this first diagnosis. Here evaluation is now patient is relieved and for pain and patient feel relaxed. Here diagnosis goal is achieved here. Next number second nursing plan देखते हैं impaired urinary elimination. Here same as nursing process step nursing assessment diagnosis goal intervention and rational. Here subjective data patient says that he is having difficulty in urination and objective data also here oliguria, hematuria and dysuria. On the basis of these data we write the nursing care plan. Nursing diagnosis here impaired urinary elimination related to stimulation of the bladder by the calculi, renal or urethral irritation evidenced by the urgency and frequency of oliguria, hematuria. Next goal to improve urinary elimination and nursing intervention and the rational. Nursing intervention number first record intake and output and characteristics of urine. Here rational for this provides information about kidney function and presence of complications, infection, and hemorrhage. Next, second intervention, determine patient's normal bleeding pattern and note variations here. Rational for this usually frequency and urgency increase a calculus near uretrovesical junctions. Next, third intervention here, encourage the patient to walk if possible here. Rational for this to facilitate spontaneous passage. Number fourth intervention, promote sufficient intake of fluids here. Rational for this, increased hydration flushes bacteria, blood and debris and may facilitate stone passage. Number fifth intervention, offer fruit juice, particularly cranberry juice here. Rational for this to help acidify urine here. Next, number six, strain all urine, document any stone expelled and sent to laboratory for analysis here. Rational for this, retrieval of the calculi allow identification of type of stone and influence the choice of therapy. Next, number seven, investigate a report of bladder fullness, palpate for the suprapubic distension, note decreased urine output, presence of periorbital and dependent edema. Here, rational for this, urinary retention may develop causing tissue distension, bladder, kidney, and potential at risk of infection, renal failure. Next, number eight intervention, observe for the changes in mental status, behavior, or level of consciousness. Here, rational for this, accumulation of the uremic waste and electrolyte imbalance can be toxic to the CNS. Number nine intervention here, maintain patency of indwelling catheter, urethral or nephrostomy when used here. Rational for this may be required to facilitate urine flow and prevent retention and corresponding complications. No tube may be occurred by the stone fragment. Number 10 here, irrigate with acid or alkaline solutions as indicated here. Rational for this, changes in urine pH may help dissolve stone and prevent further stone formation. Number 11, here check laboratory studies, electrolyte, blood, urine, nitrogen, creatinine here. Elevated BUN, creatinine and a certain electrolyte indicate the presence and degree of kidney dysfunction. Number 12 here, obtain urine for culture and sensitivity here. Rational for this, determine presence of UTI at which may causing a complicating symptoms here. After providing these interventions, we write here the evaluation here, urinary elimination improved here. Second, nursing care plan goals achieved और ये हमारा सेकंड केयर प्लान फिनिश हुआ. नेक्स्ट देखते हैं थर्ड केयर प्लान फॉर renal calculi here. This is the third care plan here. Deficient risk for deficient fluid volume here. Same nursing process step: assessment, diagnosis, goal, intervention, additional and evaluation in last. In this care plan, first नर्सिंग असेसमेंट में सबसे पहले सब्जेक्टिव डाटा पेशेंट सेज दैट इज वीकनेस एंड ऑब्जेक्टिव डाटा हियर असेस वाइटल साइन एंड वेट एंड पाल्पेबल peripheral pulses, mucous membrane and skin turgor. Next, diagnosis for this here: risk for deficient fluid volume related to the nausea and vomiting. Your goal for this: to maintain adequate fluid balance. Next, nursing intervention and the rational first intervention for this diagnosis goal achievement. First intervention: monitor and document take output and daily weight air. Rational for this: comparing actual and anticipated output made in the evaluating presence and degree of renal stasis and impairment. Number second here, note incidence and document characteristics and frequency of vomiting and diarrhea. Evaluation: nausea and vomiting and diarrhea are commonly associated with renal colic. Next, number third intervention here: promote fluid intake to liter 3 to 4 liter a day within cardiac tolerance. Here, maintain fluid balance for homeostasis and wasting action that might flush the stones out. Dehydration and electrolytes imbalance maker secondary to excessive fluid loss, vomiting, and diarrhea. Next, number fourth intervention: monitor vital sign, evaluate pulse, capillary refill time, and skin turgor and mucous membrane air. Rationale for this: indicators of hydration and circulating volume and needed for intervention. Number fifth intervention here: weight delay. Rapid weight gain may related to water retention. Number six: check hemoglobin and hematocrit electrolyte air, assess hydration and effectiveness of or need of the interventions. Number seven intervention here: if the patient can't drink requires amount of fluid supplement, IV fluid may be given here. Maintain circulating volumes if oral intake is insufficient, promoting renal function. Next, number eight, encourage appropriate diet, clear liquid, bland food, and tolerated air. Rational for this: easily digested food, decrease GI activity and irritation, and help maintain fluid and nutritional balance. After providing these interventions, we write the nursing evaluation step here. Now maintained एडिक्वेट फ्लूइड बैलेंस। तो ये हमारा थर्ड केयर प्लान कंप्लीट हुआ है। यहाँ पर नेक्स्ट देखते हैं नर्सिंग केयर प्लान नंबर फोर्थ फॉर रीनल कैलकुलाई। नेक्स्ट फोर केयर प्लान डायग्नोसिस होगा इसका डेफिशिएंट नॉलेज एयर सेम नर्सिंग प्रोसेस स्टेप असेसमेंट डायग्नोसिस गोल इंटरवेंशन एंड रेशनल nursing assessment here subjective data patient says that he is having no knowledge about the kidney stone or renal calculi or objective data anxious associated with the disease process patient looking anxious. Next nursing diagnosis देखते हैं deficient knowledge related to lack of exposure recall information misinterpretations and unfamiliarity with the information resources. Their goal is to improve level of knowledge of the patient and intervention and rational first intervention here recall and analysis disease process and future expectations here rational for this provide knowledge. Next second intervention emphasize importance of increased fluid intake 3 to 4 liter a day or as well as 6 to 8 liter a day rational for this flushes renal system decreasing opportunity for urinary stresses and stone formation. Number third intervention here review dietary regimen as individually appropriate. Diet depend on the type of stone. Here, low purine diet for decrease oral intake of uric acid precursors. Rational and low calcium diet. Rational for this reduce risk of calcium stone formation. Next, low oxalate here reduce calcium oxalate stone formation. And short regimens low calcium or phosphorus diet with albumin carbonate gel 30 to 40 ml 30 minutes PC or HS air rational for this prevent phosphatic calculi and also effective against other form of calcium calculi. Next number fourth intervention discuss medications regimen. A drug will be given to the acidify or alkalize urine depending on the underlying cause of the stone formation. Number fifth intervention here promote regular activities and exercise program here interventions rational for this inactivity contribute to stone formation. Number six intervention active listen concern about the therapeutic regimen and lifestyle change here rational for this helps patient work through feelings and gain a sense of control over what is happening. Number seven intervention identify sign and symptom requiring medical evaluation recurrence the pain hematuria oligory here prevent serious complications. Number eight intervention here demonstrate proper care of incision and catheter if present here rational for this promote competent self-care and independence. After providing these interventions we write the nursing evaluation step of this nursing care plan means here last step for this care plan. Now evaluation is the improved knowledge of the patient. तो ये हमारा नर्सिंग केयर प्लान यहाँ पर कंप्लीट हुआ। फ्रेंड्स ये था हमारा आज का नर्सिंग केयर प्लान ऑन renal calculi urolithiasis kidney stone or this is very important for examination purpose and also the प्रैक्टिकल फाइल वर्क। तो आपको वीडियो कैसे लगे इसके लिए अपनी लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस नर्सिंग केयर प्लान वीडियो विद योर फ्रेंड्स एंड सब्सक्राइब माई यूट्यूब चैनल। जिन्होंने अभी तक सब्सक्राइब नहीं किया प्लीज़ सब्सक्राइब माई यूट्यूब चैनल आनंद नर्सिंग पाइल एंड प्रेस बेल आइकन ऑल्सो। थैंक यू।